Hello guys, welcome and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and CLEX and waiting training. And welcome back to Magic Pill session. So today we are going to discuss very important topic which is previously asked so many times in the exam. As you all know, in Magic Pill session we are discussing all the questions whatever asked so far in the competitive examinations. So in the continuation of that, today also we are going to start with the important topic, that is blood transfusion from fundamental of nursing. So watch the video till the end. It will be so much useful for you. And if you like the video, please like it and share it. And if you're watching the channel for the first time, please subscribe the channel so that it will motivate us to post more and more videos. So let's begin the session. So let's start with a motivational quotes. Don't stop when you are tired, stop when you are done. So keep on trying till you achieve your goal. Definitely failures will be there. Without failure, we cannot achieve anything. So if don't fed off with the failures, so keep on trying till you achieve your goals. So with this quotes, let's start today's session. As I mentioned already, fundamental of nursing, MCQ point related to blood transfusion we are going to discuss. Let's start from the simple to complex questions. So not only we are discussing the questions, we are also discussing the additional vital points. So it will be so much useful for you. So listen carefully. The first question is, the blood should be stored at which temperature? So this is the question. As you all know, this is the direct question. Okay. So here the key point is temperature. What temperature the blood has to be stored? Okay. Let's see the options: 2 to 6 degrees centigrade, at 20 degrees centigrade, at room temperature, and none of the above. So this is very simple question and direct question. And here the right answer is option A, that is 2 to 6 degrees centigrade. In some exams, they used to give as 1 to 6 degrees centigrade. That is also the right answer. Whatever near to the answer, we have to select that. Okay. For this question, for these options, the right one is option A, that is 2 to 6 degrees centigrade. We can store the blood. Okay, fine. So additional informations are here. Generally, they have mentioned blood. Blood should be stored at what temperature? If they are specifically asking, for example, the platelet has to be stored at what temperature? The cryoprecipitate has to be stored at what temperature? The red blood cells has to be stored at what temperature? If they are asking specifically, in that situation, most of the students will make mistake. For that, to clear those problems, here have added the additional vital points also. You can just look into it. See, the first one is whole blood. The whole blood, the storage temperature is 1 to 6 degrees centigrade or 2 to 6 degrees centigrade. Both are correct only. Okay. And the shell life, maximum how many days we can store the whole blood. That is maximum 35 days we can store the whole blood. Okay, so 21 to 35 days, maximum 35 days we can store the whole blood. Where we can store? We can store in the refrigerator in the temperature of 2 to 6 degrees centigrade or 1 to 6 degrees centigrade. And the next one is RBC, red blood cell. This question related to red blood cell storage. So many times they have asked this question. So red blood cells, it has to be stored again in 1 to 6 degrees centigrade or 2 to 6 degrees centigrade. What is the lifespan? Shell life, that is 42 days we can store this RBC. Okay, and the next one is cryoprecipitate. It has to be stored in minus 18 degrees centigrade. Okay, so what is the valid period? 1 year we can store, because we are going to store in the freezer, not in the refrigerator like gold bloods and red bloods. Okay, the next one is plasma. Here, this is also stored at minus 18 degrees centigrade. This is also can be stored for 1 year in the freezer. The last one is platelet. That is 20 to 24 degrees centigrade we can store, and for 5 days, max 5 days we can store this one. Okay, in the agitator. Agitator means platelet cannot be kept in a stable place. It has to be moving like this. Okay, so that is called as what was agitator. In the agitator, we can store it for continuously for 5 days. Okay, fine. So additional informations I have mentioned here. So whole blood. So again, some of the point will repeat again and again. The whole blood 2 to 6 degrees centigrade. Already we have seen packed RBC 2 to 6 degrees centigrade, and FFB, fresh frozen plasma. It has to be stored in the freezer for minus 18 degrees centigrade or below. Okay, we can keep like this, less than or equal to minus 18 degrees centigrade. And FFB thawed. FFB thawed means fresh frozen plasma thawed. So once you taken from the freezer, usually where we will store the FFB, we will store in the freezer. Once you taken out from the freezer, we have to keep this FFB in a warm water in the temperature of 30 to 37 degrees centigrade. Okay, so almost near to the body temperature, 30 to 37 degrees centigrade, we have to keep in the warm water for at least 20 to 30 minutes. After that only we have to infuse to the patient. Okay, so like this, so 2 to 6 degrees centigrade before thawing, we can keep in the refrigerator for 2 to 6 degrees centigrade. Okay, the next one is platelet. Already we have seen 20 to 24 degrees centigrade. Cryoprecipitate, which is not thawed, minus 18 degrees centigrade, which is going to be thawed, it can be kept at 20 to 24 degrees centigrade. So these are all the additional points you're supposed to keep in mind. Okay, fine. So the next question what we are going to see is donation of a patient own blood prior to his. Actually, there is a spelling mistake. Actually, it is. Okay, is scheduled surgery is. Actually, here the patient is donating his own blood before the surgery. Okay, he is not getting the blood from some other person or some other donor. He himself acting as a donor and he is donating the blood before the surgery. Okay, so donation of the patient own blood prior to his scheduled surgery is called as. This is also a direct question. So let's see the options: autologous, homologous, monologous, heterologous. So here the right answer is his own blood is donating before the surgery. So here the right answer is what? Option A, that is autologous. So the meaning of autologous is clearly mentioned here. Autologous transfusion is the collection of, ideally 4 to 6 weeks before the surgery, they will collect the blood from the patient itself. Okay, the patient is himself is going to be act like a donor. He himself going to donate the blood for his own surgery. Okay, so they will be taking the blood 4 to 6 weeks prior to the surgery and reinfuse to the patient during the surgery. Okay, fine. So its own blood is reinfused to the patient during the surgery. So it is, which is the right answer here? Option A, that is autologous, is the right answer. Okay. So what is the reason behind this? It reduces the risk of disease transmission. Obviously, its own blood is transfused means disease transfusion chances are very, very less, and possible transfusion complication is also going to get less. Okay, like ABO, incompatibility, allergic reaction, anaphylactic reaction. So all these problems will get reduced. Okay, fine. So the next one is, a neonate requires blood transfusion after the birth. Underline the key point, neonate. We are not talking about a child or a kid or a adult. We are going to talk about the neonate. Okay, once the baby is delivered within 20, so that time we used to consider the baby as a neonate. So neonate requires blood transfusion after the birth. Which of the following cannula site is most preferred? So for a neonate, which is the best cannula site? So this is the question. And the 4 options they have given here is scalp veins, intraosseous, that is in the bones. Okay, directly they will be transfusing the bone, that is called as what? Intraosseous, umbilical cord, and subclavian vein. So these are all the 4 options they have given here, and among these the right answer is option C, that is umbilical cord. We used to transfuse in the umbilical cord for the neonate. So as you all know that the umbilical cord, it contains 2 arteries and 1 vein. So we are going to transfuse the blood in the vein. Okay, umbilical vein, we will transfuse the blood for the neonate. Okay, so the next one is, which solution should the nurse infuse before starting the blood transfusion? Even before starting the blood transfusion or after giving the blood transfusion, whatever it is, while doing the blood transfusion procedure, what fluids has to be transfused for the patient? Okay, what type of fluid can be transfused to the patient, whether it is isotonic or hypertonic or hypotonic. In case it is a isotonic, means what isotonic? There are different types of isotonics are there. What isotonic can be infused to the patient? So these things you have to keep in mind whenever you come across the question like this. Okay, so here they have given the 4 options, like 5% dextrose in water, that is hypertonic, and 0.9% sodium chloride, that is isotonic, and off NS, that is hypotonic, RL, that is also isotonic. So what solution among these 4, which one can be infused along with the blood transfusion, or before or after the blood transfusion? So this is the question, and here the right answer is option B. We can have to use the 0.9% sodium chloride or NS, that is an isotonic solution. Okay, so only isotonic solution which can be used during the blood transfusion or before or after the blood transfusion is 0.9% sodium chloride. We should not use the ringer lactate also. Okay, fine. So why? If you are using other solution, what will happen? There is a chance for hemolysis. Even if you are using RL or any other solutions other than 0.9% of sodium chloride, there is a chance for hemolysis, destruction of the RBCs. Okay, so the next one is, from the following, the most common reaction of the blood transfusion. So they are asking, underline the keyword, most common reaction of the blood transfusion. There are so many blood transfusion reactions. Already I have charted out in the rational. You can look into it. So among these 4 blood transfusion reaction, which is the very, very common blood transfusion reaction? This is the question. And they have given 4 options like hemolysis, febrile non-hemolytic reaction, fluid overload, transmission of the virus. So here the right answer is option B, that is febrile non-hemolytic reaction. So this is the most common hemolytic reactions, okay, during the blood transfusion. So let's see the rationale. See, febrile non-hemolytic reaction, as I mentioned already, it is very common and it occurs due to the antibodies which is formed against the donor leukocytes. Okay, the patient body is going to produce the antibodies against the donor leukocytes. Okay, and once this febrile non-hemolytic reaction happens, immediately the patient will have chills, fever, headache, and malaise. Okay, and the second blood transfusion reaction is hemolytic transfusion, otherwise type 2 hypersensitivity reactions. Okay, so this type of type 2 hypersensitivity reaction is very common if there is a ABO incompatibility. Okay, ABO incompatibility. That's why before transfusion we have to check for the blood grouping, blood typing, everything has to be done. After that only we have to transfuse the blood. Okay, so in that case ABO incompatibility will not be there. Okay, so suppose if there is a ABO incompatibility, what are all the signs and symptoms characterized by the patient? You can see here very clearly: fever, chills, headache, facial flushing, hypotension is a very important one, shock. If the kidney is affected, oliguria and anuria will be there. Okay, even if the respiratory system is affected, shortness of breath is going to be there, because it is a it's same hemolytic transfusion. Hypersensitivity reaction means definitely the breathing difficulty, that is dyspnea, will take place. The third one is allergic reaction. It is because of the oversensitivity to the blood donor plasma. Okay, so sensitivity to the donor plasma, it will cause what? Allergic reaction, like itching, hives, urticaria, and flushings will be there. And the fourth one is anaphylactic reaction. So these are all the 4 types of blood transfusion reaction. Among this, very common one is febrile non-hemolytic reaction. Okay, so the next one is, all these questions are asked 3 or 4 times in the exams, guys. All the competitive exams. See, competitive exams like ESI, RRB, NORCET. So all these exams are very, very common nowadays, and these exams, these type of questions are repeatedly asked in the exam. That's why I have selected few questions from the important topics and we are giving to you. Okay, the next question is, which drug will anticipate the nurse to be prescribed by the physician to a child with frequent blood transfusion? So there is a frequent blood transfusion done for a child, and as a nurse, what you can anticipate, what drug the physician will give to the patient, okay, or physician will give to the child. Okay, so this is the question. So here they are asking about the type of drug the child is going to take, okay, who is undergoing repeated blood transfusion. So let's see what all the options they have given here: iron, vitamin C, deferoxamine, and heparin. This question, I think, repeatedly 4 or 5 times asked so far in the exams. Okay, so here the right answer is option C. Deferoxamine is the very common drug which is given to the child or the person who is undergoing repeated blood transfusion. The rationale behind this is iron overload, that is called as hemosidrosis. It is a delayed transfusion complication. Underline the key point: delayed transfusion complication that develop in a client who is receiving frequent blood transfusions. Okay, so in order to prevent this iron overload, we have to administer a drug called as what? Deferoxamine. In the market, that is commercially, it is available as Desferal. Okay, which is used to remove the accumulated iron via the kidney. Okay, so this is the main reason why we have to give the deferoxamine for the patient who is undergoing a repeated blood transfusion. Okay, so far we have covered the important questions which is asked related to the blood transfusion. So if you want any other topics as to be discussed, okay, so please drop your message in the comment section. And in the blood transfusion, whatever the questions we discussed so far, if there is any doubt anywhere, you can drop your message in the comment section. We will be answering you. Thank you very much for watching the video, and if you like the video, please like it, share it, and subscribe the channel so that it will motivate us to post more and more videos, guys. Thank you very much.